Getting through lumbar back surgery. Thoughts, considerations, lessons learned. By Alan Lee Whiteman, December 2025. Legal stuff. This is for educational purposes only and my own story of experience. Talk to your doctor or trained medical professional for advice and consultation. I had lumbar back surgery on October 30th, 2025 to mechanically tie, fusing, my L4 to L5 vertebrae and fix my L5 to S1 set to correct spondylolisthesis issues. My L5 vertebrae had over a period of 6 or so years slipped out of correct position with respect to my S1 by about 25%, thus placing pressure on my spinal cord. This adverse pressure produced not only lots of back pain but secondary issues of urinary incontinence and related problems. I find the repair process experience to be up there in the realm of pain with getting a total right knee joint replacement operation. No one told me to take heed of the situation where lying in bed on my back produces lower back pain in contrast with instead lying on a guest twin bed with a harder box spring and mattress. I thought it was just a matter of getting old and my regular bed needing a firmer mattress. What I did not know at the time was that my L5 lumbar vertebrae was gradually slipping off of correct position with respect to its lower S1 vertebrae. Such slippage entails adverse pinching or squeezing of the spinal cord that descends into the hips and further down in the legs and feet. Pinching of the spinal cord means that control signals from the brain to lower organs do not work as well when the vertebrae are aligned and in correct position. Here are some before and after X-ray pictures taken from my right side to show the problem. The front view shows the screws. Before picture, after front view. Note that in the after picture, the upper screws straddle the L4 vertebrae and the lower screws mechanically connect with the L5 vertebrae above the hip bones. There are 2 round bars mechanically linking the upper and lower screw sets. The blue lines identify the L5 vertebrae. This linkage somehow forces the L5 vertebrae back into correct positioning over S1, though I do not understand why. The mechanical issues seem wrong. The discovery process. In late 2024, I had an initial injection in my thoracic area, around T6, to address growing pain in my upper back. The initial injection worked well for 2 months, requiring a second injection in January 2025. The second injection worked much better, but during a follow-up with my pain management doctor, we discussed other lower back pain associated with sleeping on my aging Tempur-Pedic bed mattress. An offer was given to me to have an MRI taken, something I should have listened to and accepted. Well, I did not, and later on in July 2025 the pain got bad enough that I asked for help, and I was given an order for a lumbar X-ray. That X-ray led to an MRI, the one I should have gotten, and the 2 led to an appointment with a spine surgeon. The surgeon looked at both image sets and sent me back to the X-ray imaging place, RCIC, for a flex extension X-ray where the object of investigation is L4 slipping in and out as my spine moves? Short answer, no, but there was sufficient slippage of L5 over S1 leading to scheduling of minimally invasive lumbar surgery to correct spondylolisthesis. See the Wikipedia article. In the weeks leading up to surgery, there were times when I could not sleep lying down, and I had to work up a way of sleeping sitting up in a rocking chair. During that time, I was taking 3 sets of tramadol 50 mg tablets with 500 mg over-the-counter of Tylenol every day. Eventually, I got to the point where I could resume sleeping on my guest bedroom twin bed mattress, and that worked up until surgery day. My surgeon's office had me look at some videos of the anticipated operation where 2 screw sets on each side of the spine are connected by vertical stabilizing bars along with bone graft pads to fuse the L4 to L5 vertebrae. The office staff also had me start physical therapy at a local regional rehabilitation center as an outpatient to strengthen my hip and leg muscles in preparation for surgery. So I did PT in a 4-foot heated indoor pool doing water resistance strengthening twice a week for 5 weeks. The surgeon's office also had me get fitted for wearing a back brace, a Trend Company product that has lots of Velcro surfaces with overlapping pull strings, so-called parachute pulls. See these pictures. The brace comes with 2 free sheets where one can be slipped into a pouch in the back for cooling relief. I tried the free sheets, but gave up on them after 2 uses. The hospital required my having the brace with me on the day of surgery, otherwise they would cancel the operation. On a Monday before surgery, I had my head hair shaved off, see the lead-in picture, in anticipation of easing the process of showering after surgery. The surgeon's office, in conjunction with the hospital, had me do a full blood workup and get some preliminary additional X-ray images to ensure that I had not contracted anything adverse that would prevent the surgery from taking place. The hospital admittance staff advised me to get antibiotic body wash for use with antibiotic pat-down pads supplied by the hospital. Here are some pictures. Hibiclens body wash on the left. 2-pack of 2% chlorohexidine pat-down pads on the right. 2 days prior to surgery involved sets of showers with the Hibiclens body wash, waiting for dry down, then rubbing of the skin with the chlorhexidine pads over nearly all of my body. I decided to get my head shaved to assist in rubbing down my scalp with the pads, not required, but thought to be pragmatic on my part. I had anxiety over my high blood pressure issues giving cause at the very last minute for canceling the surgery, but an anti-anxiety pill along with doubling up on one of my BP medications proved sufficient. The surgery and a bizarre waking up from anesthesia. A nurse in pre-op set me up with an intravenous IV and surgical gown. Yeah, right, a gown on a gurney, lying on my back, and I was wheeled in at 9:30 a.m. into the surgery theater and parked next to the operating table. The surgery staff put me under right away, adding a breathing tube down through my mouth, then rotating my body off of the gurney face down onto the operating table. I do not remember going under, but I do remember the overly painful and bizarre wake-up process after surgery. It started out like a dream and quickly turned into a seemingly torture nightmare. I was in so much pain. Pain worse than what I recall after knee joint replacement surgery. Definitely a 10 out of 10 pain experience. I must have gone through several sequences of waking up, being in excruciating pain, passing out, having dream nightmares, waking up and repeating the pass-out dream wake-up sequence. Some hours later, I woke up again at about 4 p.m. the same day in the post-operation stay overnight hospital room, much relieved of the pain, but still on some presence of tramadol or Vicodin for pain management. Actually, I was in much better shape than just after surgery. The plan was for me to stay overnight and get discharged the following morning. While I do have much praise for the hospital staff, nurses in particular, the hospital room was way too cold, my second experience at the same place, so I was motivated to get discharged as soon as possible. So, I got out of bed around 7 p.m. with a walker and started walking the hospital ward floor around the nurses' station and down and back through several hallways. I walked around for 20 minutes the first time, then 3 more walks of shorter duration, several hours apart through the evening and into the morning hours. Sleeping was difficult and hampered by yelling noises from some other older man down the hall. Eventually, the hospital staff discharged me and my neighbors drove me home, and I crashed for much of the day. I could not have really transited the experience without the help of my neighbors who brought me meals and drove me to follow-up appointments. The hospital organization set me up with a related home healthcare visiting nurse company who came by once or twice a week to check up on me. Their nice people took my vitals and recorded them on a log page in their customer packet. In the almost 4 weeks after surgery, I dropped 11 pounds. I had my last tramadol 50 milligrams tablet, the lowest grade opiate, on November 2nd, 2025, though I continued to take 500 milligrams tablets of over-the-counter Tylenol. Eventually, I got to the point where the Tylenol was giving me adverse side effects of bizarre and disturbing dreams. I think I am now Tylenol antagonistic and have to weigh the choices. Is still being in pain and discomfort better than having bad dreams? A tough choice. Surgery involves having coverings over the incision lines. The bandage coverings stay on for 10 days and then can be removed. The bandage patches have a 3/4 to 1 inch wide adhesive band all around the outside edge of the bandage. The adhesive part is very sticky and portions of it remain on the skin after the bandage is peeled off. An alcohol wipe is required to remove the residual sticky adhesive on the skin. No mean feat. Here are some pictures of the bandages. On, flipped over, removed. Note the very minor bleeding issue with the right side incision, and also that the incisions are not directly above the spine, but rather off to the sides. After returning home, I made some Amazon purchases to help with being home alone and beginning the recovery process. Oh yes, driving myself again in my pickup truck 3 weeks out from surgery, still wearing the back brace while away from home. Some pictures. A Glacier Bay bath and shower chair, which is impervious to water. I use the chair for sitting down in the shower and getting access to my feet and toes. Also for propping up my feet for leg drying. A vertical 24-inch Glacier Bay grab bar in my walk-in shower. Both purchases were at my local Home Depot store. 2 36-inch horizontal grab bars from Amazon in my walk-in shower. Kohler electric 36-inch grab bars, polished chrome. The bars are attached with a combination of long screws reaching interior wall studs and with molly bolts. The bolts have plastic anchors and screws fitting into 1-inch thick combination of cement backer board, think Duroc, and travertine stone panels. I should have put these in years ago way in advance of surgery. I use them all the time now. Household items from Amazon. A grabber comes in a box of 2, and a liftable dustpan. The dustpan is liftable so that I can pick up a cat food bowl or a water bowl without having to stoop or bend over. Likewise, I can lower a refilled bowl to the floor and draw the bowl out with a grabber. The grabber is very useful for picking up things on the floor without having to stoop or bend over. I make this video 40 days out from lumbar back surgery. I am glad that I had the operation performed, for I would have been in really bad shape a year from now had the surgery not been performed. My head hair is growing back, real slow on top and faster on the sides and back. Today I have my second to last visit with the surgeon's office. The visit will be to review the after-surgery x-rays, get an okay to stop using the back brace, and get another prescription for physical therapy at the rehabilitation center in 2026. I have one more final visit with the surgeon. A bit of advice should you be going through this same experience. Plan ahead for things like shower upgrades, grab bars, and a chair. Keep a positive mental attitude. Know that you are more than any of your temporary clinical assessments. Keep a 3-ring binder of notes, imaging-centered data discs, after meeting doctors' notes and recommendations. You too can successfully get through lower back surgery.